Great. Welcome everyone to House Healthcare. It is Wednesday, January 3rd, and we're all excited to be back in the building, although our work has been happening throughout the summer, which is why we are able to start strong and start right up with the bill. So we're going to take up H247, which is an act relating to Vermont's adoption of occupational therapy licensure compacts. I figured we had so much fun with compacts last year. We're going to start off with all of them this year and hopefully move them across the hall. So we have Representative Mary Catherine Stone with us, who is the sponsor of the bill. So she's going to start us off with why she sponsored it, and then we'll have Jen do a walkthrough of the bill. So all yours. Hey, just introduce yourself for the record.
Yes, good morning, y'all. I'm Representative Mary Catherine Stone of Chittenden 14 in Burlington, Vermont. Thank you for allowing me the opportunity to present H247, an act relating to Vermont's adoption of the Occupational Therapy Licensure Compact. I know that compacts are not a foreign concept to this committee, so I will not belabor this portion of testimony and will rather hand over the bill walkthrough to Legislative Counsel. I'm also going to return later this afternoon to provide more testimony in my capacity as an occupational therapist who is currently practicing in this state. Thank you again for your time and for your consideration of this important legislation.
Great, thank you. Since she's back with us this afternoon, we'll hold questions. So now my question is, Jen, how long is the walkthrough? And I'm wondering if we want to do Lindsay first. It's up to you, Lindsay. Do you want to provide your testimony first or have us do the bill walkthrough?
That's fine. I'm happy to go now if that's
okay. That'd be great. You can just introduce yourself for the record.
Yes. I'm Lindsay Thrall. I'm an occupational therapist and president of the Vermont Occupational Therapy Association. And I do have screen sharing capability here. I have a PowerPoint for you all. All right, let's see.
And Lindsay, did you send this into Claire? Okay, so Claire.
I did last night.
Great. So this is posted online for anyone who wants to follow that way. Great. Thanks, Lindsay. Go ahead.
Yeah, thank you. Okay, can you all see my presentation?
Yes.
Okay, so thanks to the committee for having me today. Like I said, I am Lindsay. I am president of the Vermont Occupational Therapy Association, and I'm here to talk about the licensure compact. Just quickly, an overview of occupational therapy. We're a holistic profession that serves people across the lifespan, and we help clients participate in meaningful life activities and we can do things like providing recommendations for activities of daily living, adaptive equipment to make daily tasks easier, caregiver and family training, returning to work, school and leisure after illness or injury, cognitive performance, fall prevention, aging in place, home safety and accessibility. We also practice in mental health areas, less so in Vermont than in some areas, but that is one of our scopes of practice. And then there's other emerging practice areas like supporting people in homelessness and those kinds of things. So we kind of cover the gamut, and we're a very holistic profession, and we work with a lot of different people, different ages. The workforce census of occupational therapists in Vermont from 2020 showed us that there were 412 licenses renewed in 2020. That was both occupational therapists and occupational therapy assistants, and 313 active practitioners in Vermont. And research tells us that there is a national shortage of occupational therapists, and that the average growth rate of the OT profession from 2022 to 2032 nationally is 12% compared to the rate for all professions of 3%. And so I was not able to find data on the shortage in Vermont, but I can say anecdotally that it can take a long time to fill OT positions in Vermont, and there is definitely a shortage here. I think we are lucky that the University of Vermont just started our first occupational therapy doctorate program, so we should have more professionals entering the workforce soon. But there is a shortage nationally and I would say locally as well. So the practice settings, the primary practice settings for OTs in Vermont are school and college system, and this is from the workforce census as well. School or college system, which I would say the vast majority of those are probably elementary schools. That's about 26%. followed by home health, skilled nursing, outpatient, and hospital or medical center. And so the Vermont Occupational Therapy Association is our statewide member organization. We're run by a board of volunteer directors, and we do advocacy for the OT profession and also provide continuing education for our members. We have 129 members currently, and some of those are students or retired practitioners. So we have 112 active practitioners, which is approximately 20% of the licensed OT practitioners in Vermont, which is actually a really good engagement rate compared to, from what I understand, other associations expect about 10% of the workforce to be, involved in their state or national association, and we have 27%. So we have a very engaged association, and VOTA has reached out to our members around the compact and gotten feedback around the compact. We had at our 2023 conference, we had Chuck Wilmarth from the American Occupational Therapy Association do a presentation and Q&A. And we also did a member survey before we started pursuing this compact. And we did get a great response rate. It was about 10%, but we did not hear anything really negative about the compact. We had 80% of respondents saying that they felt it would positively impact OT practice in the state, and about 20% weren't sure. But in my experience of administering surveys, you definitely hear when people are upset about something or don't want something. So I think that was a really good sign that we didn't hear that anybody was really concerned about this. Some of the qualitative data from this survey, this would be very beneficial, especially if New Hampshire and New York joined, particularly due to Dartmouth Health serving many New Hampshire and Vermont residents. I do think we have quite a few people working in 2 states in the Upper Valley, so I think that's a valid point. And then another person said, at one point I held licenses in Vermont, Massachusetts, and New Hampshire. Having to work in each state was a nightmare. But for a while, I had work in each state with its own application headaches. The compact would make this process almost seamless. It would also make providing telehealth easier. So those were some of the pieces of feedback we got from members. This is the compact map. So you'll see Vermont actually should be this kind of green color. Since we've introduced legislation, but there are 28 states that have passed the compact, including New Hampshire, who is, that, like I talked about, the Upper Valley being an area where I think a lot of people practice across state lines. And Massachusetts and New York, our other 2 border states, have introduced legislation. So I'm sure you're all familiar with compacts. So I didn't do a lot on details, and you're going to get a bill walkthrough obviously in a moment, but it's the same in form and function as the PT and nurse compacts. You have to have a license in good standing in your home state. And if you wish to work in another state, obtain a compact privilege. And if your home state does not require an FBI background check, you'll need to get one in order to obtain a compact privilege. And the OT compact preserves the regulatory authority of each member state to protect public health and safety through our existing structure. And Vermont would continue to determine the requirements of licensure and maintain our scope of practice that we have set in our Practice Act. So the Vermont Occupational Therapy Association supports the compact because it preserves and strengthens licensure systems and enhances public safety. It creates a communication channel when there are violations of licensure, where states can communicate with each other more easily. It improves access to occupational therapy services. Particularly, I think this is important for telehealth and more rural areas of the state that may not have access, as good of access to occupational therapy. You're going to hear from some more people this afternoon about some of the access issues. But when I looked at the workforce survey, not every county has an occupational therapist whose home base is in that county. Some of them have 0. So I think this is an important piece of creating better access. It increases the market opportunities for occupational therapists and occupational therapy assistants, and enhances our mobility. In addition, it supports relocating military spouses. So when military families are moving around the country, they can more easily obtain spouses can more easily obtain licenses. It improves the continuity of care when clients travel or relocate. Encourages cooperation among states. I kind of mentioned that before, and then streamlines, excuse me, the licensing application experience. And so you will also hear this afternoon about how long it can take to get licensed in multiple states and the delays that that can cause, particularly when having traveling OTs, which we rely on a fair amount in Vermont in certain practice settings. So that amount of time that it takes can be significantly shortened with the licensure compact. And then I would also add that it's supported by the Vermont Coalition for Disability Rights because it will provide more access to services for people with disabilities. They have it on their legislative platform as well. Frequently asked questions, what is the cost? Vermont can set its own fee for compact privileges, so there is no anticipated cost, additional cost. The PT, where the PT compact is active, they have not seen major implications for state budgets. And one question we got on our survey was, will Vermont lose jobs to out-of-state workers, particularly for students who are graduating? And again, this has not been seen with the PT compact in the few years that it's been implemented, excuse me. So we don't really have any concerns, and we are excited that this opportunity is in front of us, and appreciate your support. And I'm happy to take any questions.
Great, thank you, Lindsay. If you can also take down the presentation so we can see you, that would be great. Mari, and then Alyssa.
Thank you, Lindsay. Nice to meet you. I'm Mari. I'm also an RN, so I'm familiar with your work from that side. I'm not sure of licensing for OT. Are occupational therapists required to have a PhD in Vermont? And if so, is it possible that would be a barrier to OTs in other states that don't have PhDs? And then a follow-up question, does this compact include OT assistants? And are they licensed? Does OPR license OTAs?
So to answer the second question first, yes, it does include OT assistants, and yes, they are licensed. And the first question, anybody who's grandfathered in is able to practice. So nationally, we have occupational therapists practicing under a bachelor's degree if that's what they obtained, at the time when you were allowed to be licensed under a bachelor's degree. So there's no issue with a minimum education requirement. A lot of programs are going to an entry-level doctorate, but it doesn't mean that if you were grandfathered in, you won't be able to practice.
So at this point, Vermont does require a PhD to practice?
No.
Okay.
No, you can
Not
have
like
a
physical
bachelor's.
therapist.
Yeah, you can have a bachelor's degree and practice if when you graduated from your bachelor's program that you were allowed to be licensed at that time.
Okay.
You were grandfathered in under that licensure. So it can be a bachelor's. Many of us have masters. I have a master's degree, and we're seeing quite a few more entry-level doctorate programs, but it won't affect.
Okay.
The education level won't affect this.
Thank you.
Yes.
That was actually sort of my question. Thank you, Lindsay. I'm confused though, grandfathered in as far as, so if I graduated today with a bachelor's, I would not be able to be licensed in the state of Vermont.
Correct. Yep.
So does the compact have less stringent requirements for education than for out-of-state providers than what we currently have as Vermont licensure requirements?
I don't believe so.
Not being grandfathered.
I don't believe so. I mean, occupational therapy has not gone to, as a profession, currently is a minimum master's degree to practice. But I'd have to check on this, but I have not understood that it would change any of the education requirements. I think nationally, we still have people at a bachelor's degree receiving licenses in probably every state. I would have to double check to be 100% sure, but I have not heard that issue come up. And those programs who are going to a doctorate program that is voluntary, we are still graduating people and licensing people at a master's degree level as well.
And Lindsay, we have OPR coming in this afternoon, so we'll be able to ask those questions as well.
And just really quickly, your very first slide, fully 1/4 of licensed renewals are not currently practicing. Is there a sense of where those people are? Are they retired? Are they out of state providers? Are they like?
I don't, that was from the workforce census report. I do not have a sense. It didn't give me a sense of where those people are. I think sometimes you will have people who come and practice in the state on a traveler contract and then leave again, but they obtained a license and, or maybe are keeping it live because they might come back or those kinds of things. Or one of those people might be myself, who I'm not currently in clinical practice, but I'm still keeping my license active because I may return to it sometime. So
Thank you. Thank you so much.
Right?
It's my understanding that with compacts, like some states have been resistant to join them. For example, I think I heard that California and New York State were resistant to join some compacts. I'm wondering, I saw that legislation was pending in New York State, but I'm wondering what the dynamics are with New York State and this particular profession joining the compact.
yeah, from what I understand from the American Occupational Therapy Association is that New York may be a state that takes a long time to join if they do join. California, they said, would probably be the last state to join because they feel that their licensing is good the way it is, kind of was the sentiment that they told me. So it's true. I don't know that New York will be a state that passes it right away. I also I'm not myself not familiar with those dynamics. That was just what I had heard from the American Occupational Therapy Association. The representative I talked to felt like Massachusetts would be more likely to pass it. But New Hampshire
has, right?
Yes. Yep.
Yeah.
New Hampshire has enacted it. Yep.
Great.
And I should say too that the compact, nobody's getting a compact privilege yet. They're still operationalizing it and finding the software vendor and all of those things. So that hasn't happened yet. So many states have passed it, but it isn't in effect yet.
Any other questions for Lindsay? Great, thank you very much, Lindsay. We appreciate the information. You're happy to stay on, happy to leave, whatever you want to do. And we'll have Ledge Council come up and do a walkthrough.
Is this another 70 page bill?
Yeah, I was gonna do that here.
The PDM one is shorter.
Bobby Walker.
Little Aladdin joke.
There's not a repetition though, isn't there?
Yeah, I'm all set up for you. Welcome.
Good morning.
Good to see you. Yeah.
Jennifer Carby, Legislative Counsel. So I had prepared a section by section that's only 4.5 pages because it helped me get my head around some of the provisions in here. And so that's on the website. I don't know if you want me to put it up or it's just what I'm going to sort of use to.
Why don't you put it up? We'll follow along from there.
Okay. And
It'd be great. Just to thank you for taking the time to do the section by section. And while she's doing that, I just want everyone to know Representative McFawn just couldn't be here today. He will be here tomorrow. And Representative Carpenter is taking her daughter to college. So she will be with us on Tuesday.
Hopefully the seat's dry by then.
Yeah, so please it's dry by then.
What happened?
We will, Art had a little accident over there.
Somehow the whole thing went by and no one noticed it.
It's been so long, he thought his water bottle was his iPad and he went
Right,
to
right.
click it.
this is it. Okay, great.
Great.
So again, good morning, Jennifer Carby, Legislative Counsel. And this is a section by section summary of the bill as introduced for this H 47, an act relating to Vermont's adoption of the Occupational Therapy Licensure Compact. The bill has two sections. The first one is almost the entire thing, which is enacting a new subchapter in the existing chapter on licensure of occupational therapists and occupational therapy assistants. So the first section that it creates within that new subchapter is kind of standard language around it being the adoption of Vermont's adoption of the Occupational Therapy Licensure Compact. Then it goes into the purpose of the compact, and some of this is going to kind of repeat some of the points from Lindsay's slides. But what they state is that the purpose of the compact is to facilitate interstate practice of occupational therapy, OT, with the goal of improving public access to OT services. They specify that the practice occurs in the state where the patient or client is located at the time of the patient or client encounter, which we've talked about a lot in the context of telehealth. It lists several objectives: increasing the public's access to OT services by mutual recognition of other states' licenses, enhancing the state's ability to protect public health and safety, encouraging the cooperation of member states in regulating multi-state OT practice, typo there, supporting the spouses of relocating military members, enhancing the exchange of certain types of information around licensure, investigations, and discipline between member states, allowing a remote state to hold a providers participating in the compact accountable to that state's practice standards, and then facilitating the use of telehealth to increase access to these services. There are several definitions. I've just picked out a few that are kind of compact language specific ones. One is this idea that we've talked about, or you've talked about, I know, in other bills, of the compact privilege. That's what allows its authorization that's equivalent to a license, and that's what allows the practitioner to practice in the remote state, even though they have not applied for a standard state license in that state. They're practicing in the remote state under that state's laws and rules. And again, it reiterates that the practice occurs where the patient or client is located. Home state, this is the member state that is the licensee's primary state of residence. There's language in here using the term jurisprudence requirement, and that has to do with an assessment of an individual's knowledge of laws and rules governing the practice of occupational therapy in a state. A member state is a state that has enacted the compact. A remote state is a member state, but it's a state other than the home state where the licensee is exercising or seeking to exercise their compact privilege. And then a single state license is kind of your traditional state license. It's a license issued by a member state that just authorizes practice in the issuing state, does not affect compact privilege, does not give any compact privileges to practice in any member state, just a regular single state license. So there are a number of things that a state has to do in the next section to participate in the compact. We would have to license, as we currently do, occupational therapists and occupational therapy assistants. We have to agree to participate in the Compact Commission's data system. There's some more about that later on. We have to have a mechanism in place for receiving and investigating complaints about licensees. That's what our Office of Professional Regulation does. Notify the commission of any adverse action we take or investigative information the state has about a licensee. Consider criminal history records when someone applies for the initial compact privilege. Comply with the commission's rules. Use only a recognized national examination as a requirement for the license, and require continuing competence or continuing education for renewal of a license. The bill would require a member state to grant a compact privilege to a licensee who has a valid unencumbered license in another member state. Does allow member states to charge a fee for granting the compact privilege. So that has not been the case in some of the compacts we've looked at. We'd have to, as a member state, provide for our state delegate to attend all commission meetings. And then this specifies that a non-resident can continue to apply for a regular single state license here, but again, that doesn't give them any compact benefits beyond the state. So the compact privilege itself is in 3369, and this is a list of the things that a licensee must do in order to exercise the compact privilege. So first, they have to hold a license. They have to hold a regular license in their home state. They have to have a valid social security number or national practitioner identification number. They cannot have an encumbrance on any state license, and they must be eligible for the compact privilege in any member state. They have to notify the commission that they intend to seek the compact privilege in remote states, pay any applicable fees, complete the required criminal background check, meet any jurisprudence requirements that the remote states require, and report to the commission adverse action taken by any non-member state within 30 days after the adverse action is taken. So for all the member states, they're sharing data about adverse actions in the data system. But if it's a non-member state taking action against a licensee's license in that state, then they have to report, the licensee has to report that to the compact commission. The compact privilege says it is valid until the expiration date of the home state license, which really just means you have to keep your active home state license. That's kind of the key to having the compact privilege. A licensee who's providing services in a remote state has to function within that state's laws and regulations. There are requirements around supervision of occupational therapy assistants, and if they're practicing in a remote state, they have to be supervised by an occupational therapist who holds a compact license or compact privilege. So it has to be someone who's authorized to practice in the remote state. As we've seen in many of these, the licensee providing services in a remote state agrees to be subject to that state's regulatory authority, and there are a number of things that the remote state can do. If the home state license is encumbered, the licensee will lose, so this is a sort of automatic trigger to lose the compact privilege in any remote state until 2 years after the home state license is no longer encumbered. In addition, if the licensee's compact privilege in any remote state is removed, the licensee may, but it's not automatic, lose compact privilege in any other remote state until the period of time that their compact privilege is removed has ended, all of the fines have been paid, any conditions met. 2 years have passed from the end of them meeting all of their requirements for the removal to be lifted, and the commission has to reinstate compact privileges and update the system accordingly.
Just a quick question, Jenna, on that language. That's all in the compact that exists now, correct?
Yes.
Okay.
Obtaining a new home state license by virtue of compact privilege. So this is a way where a member can potentially leverage their compact privilege to change their home state if they're moving. You can only hold a home state license in one member state at a time, and the home state license is the one that triggers the compact privileges in all the member states. So you can hold a single state license. You can be fully licensed in multiple states. You can just only have one actual home state. If a practitioner moves from one member state to another, they have to apply for a new home state license, and they can do that by virtue of a compact privilege. And they have to pay the required fees and let both states know. But the idea here is that the new home state can rely on the compact data system to kind of fast track a lot of that information about their eligibility for licensure. Except the licensee still has to get an FBI fingerprint-based background check if they hadn't had one earlier, complete any other criminal background checks required by the new home state, and submit any jurisprudence requirements showing they know the laws around occupational therapy in the new home state. Also pay all applicable fees for the new home state license. And then if a licensee moves from a member state to a non-member state, or from a non-member state to a member state, then the state criteria would apply for issuance of a single state license in the new state. So you can't leverage your compact privilege to move between member and non-member states. It only works from member state to member state. 3371 is a short section around active duty military personnel and their spouses. So it says an active duty military personnel or their spouse who's an occupational therapist must designate, or occupational therapy assistant, must designate a home state in which they're currently licensed in good standing. And then they can keep that home state designation while the service member is on active duty. So even if they're not physically located in that home state, while the service member is on active duty, they can keep that home state designation. But after designating a home state, they can only change to a new home state through an application for licensure, applying for a license wherever they move to next, or going through that process for obtaining by virtue of compact privilege. There is a significant authority to take adverse actions against licensees as appropriate. So the home state retains the exclusive authority. Vermont would have the exclusive authority to impose adverse action on the home state license, on a Vermont licensee who declares Vermont as their home state. Remote states can take adverse action against the licensee's compact privilege in that member state, and they can issue subpoenas for witnesses and evidence if they need to take that adverse action. The compact directs the home state to give the same priority and effect to reported conduct received from a member state as it would if the conduct occurred in the home state, and apply home state laws to determine appropriate action. So basically, they're not supposed to say it happened in another state, we don't care. They're supposed to give the same priority, kind of take the same level of interest that they would to reported conduct that occurred in a member state they would if the conduct occurred here in Vermont, but they would apply Vermont state laws or home state laws to determine appropriate action. So they could pay attention to it, but if it was okay under Vermont laws, then they wouldn't have to take action on that basis. A member state can take adverse action based on the factual findings of fact from a remote state, but the member state must follow its own procedures for taking adverse action. There are some provisions around individual state and joint state investigations. And then I just wanted to flag that if adverse action is taken by a home state against the license, then the licensee's compact privilege in all other member states, and we just look at the sort of automatic trigger, is deactivated until all encumbrances are removed from the state license, the home state license. And member states must promptly notify the administrator of the data system. If they take adverse action, the administrator then must notify home states of adverse action taken by member states. Next section is establishment of the Occupational Therapy Compact Commission. This is pretty similar to other compact commissions you've seen in other states. It's created by the member states. Every state gets one delegate selected by their licensing board. That person gets one vote on the commission. It's a description of the commission's powers and duties, including establishing bylaws, promulgating rules that are binding on other member states, establishing a budget, spending money, and establishing and electing an executive committee. That executive committee has 9 members. They have duties as well, sort of related to the running of the commission and administration of the compact. So they can recommend changes to rules, bylaws, this legislation, member state fees, things like that to the full commission. The commission is authorized in the compact to impose an annual assessment on each member state or fees on other parties. So I want to flag that. As you heard, and from what I've seen from their website, there is not a current annual assessment, but there is authority for that. Then we have the data system. The compact requires the commission to provide for a coordinated database and reporting system with information about licensure, adverse actions, and investigations of licensees in all member states. Requires member states to, I'm not sure what subject here is, but a uniform data set on all, submit a uniform data set on all individuals to whom the compact applies, including a bunch of different pieces of information. And the commission must promptly notify all member states of any adverse action taken against a licensee or applicant. I'm just going to change this while we're in it. All right, rulemaking. Commission has the authority and is directed to promulgate reasonable rules to effectively and efficiently achieve the compact's purposes. But a majority of the legislatures of the member states can reject a rule. So the rules are voted on by the commission, but the majority of the legislatures of the member states can reject a rule by enacting a statute or resolution. They have 4 years from the adoption of the rule to do so. Rules and rule amendments are adopted at commission meetings. There's some advance notice required, and there are certain opportunities for public hearing on proposed rules. And there are some provisions around oversight, dispute resolution, and enforcement. So if a member state defaults on the performance of its duties under the compact or rules, then there are provisions around providing written notice to the defaulting state and notifying the other member states, also giving the defaulting state an opportunity to cure, so to fix whatever their default was and to get some remedial training. A defaulting state that doesn't fix the default can be terminated from the compact if the other member states vote, but termination is the last resort, so they're going to try to work things out. And there's an appeal right there. The commission can also attempt to resolve compact-related disputes between member states if the member states request it. Date of implementation. So the compact came into effect on the date of enactment on the 10th member state. As you heard from Lindsay, and I had an earlier number, I guess, so I updated it. 28 states currently have enacted the compact, and that's on the commission's website. A member state can withdraw from a compact. This is typical in compact language as well by repealing the enacting statute. So we could repeal this subchapter, and 6 months after the effective date of the repeal, the state would be withdrawn from the compact. Amendments to the compact so any changes to what is currently in front of you would only be effective and binding upon enactment by all member states. So at this point, 28 states would have to adopt amendments in order for those to be effective. Then there's a severability provision saying if any provision of this compact is found to be in conflict with the state constitution or the U.S. Constitution, or there's some other issue with its validity as applied, the rest of the compact remains valid. And if it conflicts with one member state's constitution, it's only invalid on that piece as to that state. The rest of the states are unaffected. Licensee providing occupational therapy in a remote state under the compact privilege must operate within the laws and regulations of the remote state, which we've seen a number of times, and the compact is binding. And then as drafted, as introduced, the compact would have taken effect on January 1st of 2024. That was introduced last session, so you need to update at least the effective date. And that is it. So that is 4.5 pages instead of 41, but still pretty long.
Thank you.
Sure.
Nice job. All right, and then Alyssa.
Thank you, Jen. Under 3269 compact privilege for licensees, it says that the licensee must notify commission of intent to seek compact privilege in a remote state. I don't remember that being the case for other compacts, and maybe I just missed it. Like, if I went to myself as a travel nurse and working in another state, I didn't notify OPR that, hey, I'm going to go work in Virginia now.
Remind me which section you're in.
3369, it's about the fifth bullet point down.
Sorry, tell me which one you're.
Notify commission of intent to seek the compact privilege in remote state.
Commission, not OPR.
Right, I was talking about myself as an RN going to OPR. I'm just saying, I don't remember this language being in other compact legislation that we've passed. Is that what that means? That if an occupational therapist wants to work in another state under the compact, they have to let the Vermont licensing body know that they're going to do that?
So for whatever reason, I am having a hard time finding this literal language that you're looking at. So, and that short list under the first bullet. Okay. So in order to exercise the compact privilege, a licensee must, this is what the language says. So whether that is different from other states, I don't know how much you have to notify them each time or just say, I have to look. It just says, to exercise the compact privilege, a licensee shall, and the actual language says, notify the commission that the licensee is seeking the compact privilege within a remote state, parentheses S. So I don't, remote state or states. So I don't know if that by that they mean notify the commission that I'm planning to use this, or if you have to say I'm planning to use this in this state and 6 months later, I'm planning to go to another state, now I need to use it there, I want to use it there. We'd have to look at what some of
There's
their.
the commission in that
The
language.
commission is, so the commission, oh, right, the commission in this case is always the compact commission, the Occupational Therapy Compact Commission.
OPR.
It's not OPR, it is the governing commission for the compact. But what it means by what the process looks like by which somebody is notifying the commission that the licensee is seeking compact privilege within a remote state, we sort of presume that what they mean is, hey, commission, I'm here, I'm planning to actually use this. I'm applying for the privilege and I'm planning to actually use it.
I guess it's not that big of a deal, but it seems kind of a little bit burdensome.
It is all part of the compact, so we don't get a choice about what the compact says or doesn't say. We either say, yes, we accept the whole thing, or we don't join it. So yes,
I would keep
so we might,
For OPR, they might have some more.
we might have worded things differently to clarify intent, but unfortunately, we don't have that option.
I'm sorry, are you done, Lauren?
I'm done. Just a question about the fees, because it seems like every one of these compacts is different. So if you were applying for the compact and your home state is Vermont, OPR would have a compact fee, licensure fee, you would pay that.
So if you are applying so you have to get fully licensed in your home state.
Yeah.
So you get fully licensed by Vermont, and you pay the regular Vermont license.
You pay the regular license fee, but then you also pay Vermont a compact fee to join the compact. Can we also charge?
I don't think you are. I don't think you are. I think you may be paying the commission of the member states can charge a fee for granting the compact privilege to someone who's licensed in another state.
Okay, that was my question. So if you practice in Texas, your home state, and you decide you want to get a compact license to practice here, you want to.
Compact privilege, yeah.
Compact privilege, then we get to charge a fee.
Yes.
Okay. Yeah.
And it's confusing. Leslie?
So my question's more general than
Okay.
just the OT thing, because I think we've looked at a lot of them. There's the MD, the RN, counseling, PT, audiology, SLP, and psychology are the ones that I know about. There may be more.
Good job, Leslie.
I know.
I just went to bills out of our committee, so it wasn't. But what I'm wondering is how different are all these? Or is this really repeating the same language over and over again? Or is it materially different that we need to see what's different about OT as opposed to psychology?
So I think each compact is different because it's being developed by that particular field. So they're all doing things. So I think there are a number of similarities. I think that the Council of State Governments provides some support with creation of compacts. I think they have an arm that does that. This one may in fact be part of that as well, or been developed in consultation with them, but they are all different, I think, in their own ways. They use some different terminology. So I do think you can't just say it's another compact and this time
So I have to pay more attention than I've been doing, I guess, sort of.
I don't know how to
say
but there's a reason we walked through the whole thing and I didn't say, it's just like the psychology compact, except it's occupational therapists instead of psychologists.
Because I'm trying to understand the differences, and I probably don't need to just stay focused on this. Okay, I just needed help around that.
Right, since we can't change it, I would
Yeah,
stay focused on what's in front of us.
Totally.
And, OPR helps us understand what's unique about this one.
Okay.
Exactly, yes. I think as the ones who participate in each of these or in some way, then I think OPR is a better place to say, we have to do this differently. Vermont has to do it differently for this one, or this is the one that doesn't allow us to charge any fees to people coming into practice here. But this one you're looking at.
Exactly what I want to know. How is this different from everything that we do?
Yeah, we can talk to it here.
Yeah, that's great. Thank you.
Art?
Actually, I think I'll save my question for OPR. They're coming in later.
Yes.
Okay, it's more to do with, because Alyssa's question got me thinking about the fees, and then I'm confused now.
Okay,
So
yeah,
we'll wait for
we'll
later.
have OPR.
Yeah.
Jot it down. Anyone else? Questions for Jen? Great, thank you, Jen. All right, so this afternoon, we'll have OPR, and then we'll have several current occupational therapists who will walk us through a bit more about what they do what they think the compact will be helpful to them. And then we'll be done with testimony at the end of that. We'll definitely adjourn by 4:15. So,
Voting today on?
no, we are not voting today on it. Not yet.
Not rushing, just curious.
Yeah, no, not today. So thank you, everyone.